Can we make a start? Okay. The reason why I wanted to do a teaching on this trauma is, a lot of our patient also has the childhood trauma, and I think it's also a big time for us to reflect. We also have got some kind of issues in the childhood, and we have to reflect that the way we present now also depends on all the experience that we had during the childhood. So as a practitioner, I think it's also important for us to reflect. Has anything happened in the past that make us react the way we react now? Okay, so it's a big time for us to reflect. Can you go to the next one? Okay, so the things that I want to cover in this is 4 things. How do we define trauma and different components of trauma? Then we also have to go through the manifestation of trauma. When the trauma happens, what are the consequences that it makes an impact in your life? Yeah. And we also want, and the third, there's a bit of neuroscience we want to understand what actually goes in the brain. And the last bit is, after learning all of these 3 things, what change we are going to make. Okay, hope, healing, and recovery. Like if anything happens like a trauma, it's not fixed. In our brain, we have got neuroplasticity. That means that we always have a chance to recover and heal. Okay, so these are the 4 things that we are going to cover. Now, when I cover this topic, after each blocks, we'll do a bit of reflection on our own life. So it also helps us to learn from it. Yeah. So let's go to the first one. Okay. So before we go to the next slides, what are your understanding about trauma? How do you define trauma? Hi, please come in. Yeah, have a seat. Just to give you a bit of summary, today I wanted to do a bit of teaching on trauma, childhood trauma on this. So this teaching, the reason why I'm doing this teaching is, this teaching will also help us to reflect on our own life. It's not just the patient, to see just to have a better understanding of our own trauma, to see how best we can implement in our own practical life as well as in our own personal life. Yeah. So the first thing is trauma. How do you define trauma?
It comes with like safeguarding things now, which are could be like emotional neglect, physical neglect, food neglect. It could be sexual abuse.
Yeah.
Lack of education, lack of socializing.
Yeah. So there are multiple factors, it's not just one.
Something bad that happens that affects you.
Yeah. In a simple term.
Yeah.
Yeah. Okay. So let's go to the definition. Yeah. So keep in mind, in a simple term, trauma is not an event itself, but the body and mind response to distressing event. Does that make sense? So it depends. It's not only the event, but it also depends how our body and mind give a meaning to this and how we define it. Okay. So this is like a simple definition that you find in any of the Google. Yeah. Now the second thing is, when this happens, what are the coping mechanisms that we have? Okay. Is the coping mechanism able to tolerate it, or does it become overwhelmed? Okay. So this is the second phase. Yeah. On the third phase, then there is an image of circuit of breakaway with tripped switch. So imagine that if you are not able to tolerate it, basically it's like a cable car with electric breakdown, or a tree falling or stuck in the way. Yeah. Now you aren't just remembering the past, you are also reliving in the muscles and the nerve. If you're not able to deal with this, that image gets stuck in your mental. Okay. So every time when you go through similar kind of experience, you are reliving. Okay. And keep in mind, the body and the mind cannot differentiate between imaginary and real. Okay. So it can relive, and this cycle goes on and on and on and on. Yeah. So are you clear with this? Any question on? Yeah. Let's move to the next slide. Now, in order to understand the impact of the trauma, okay, there are a number of things that we need to see. Especially in a child, the brain is still developing. It's not like the full form. Can you take a guess at what age the brain fully develops? 25. So it's like still a building block. Yeah. The trauma derails the brain development. Okay. There's a good book if you guys have got a chance. Man Raised by a Dog. Okay. This book is written by a neurologist from America. So in this book, it's a lovely book. It describes about the children who are abused and when they are brought to the foster care, they tend to do the scan of the head, and they see the impact of the trauma. So what they have noticed is, especially children between the age of 0 to like 10, if they have faced abuse and this and that, when they do a scan, the brain are not developed at all. And what they have also observed is, when those children, when they receive proper care and love, the brain develops faster. And there's also some of the studies which is done that, some of the children who are in the forest and lost, raised by animals, the brain doesn't develop at all. So when they get the human touch and love, the brain tends to develop. Okay, so this is quite interesting. Now keep in mind the key points to look for is children's brain is like a house under construction. It's not fully developed. So imagine if you're building a house, and the problem is if you're not putting the bricks properly, the end product won't be good. There's a high chance of the house breaking it. Trauma acts as a massive earthquake, forcing resources towards survival. So, when the trauma hits, when the brain are fully not developed, it's more of like they look for survival. They don't look for new, love, care. They go to the basic instinct that I need to survive. Yeah. So when they even grown up, they are also in the same mentality. When similar kind of thing happens, they are more focused on the survival. Yeah. Focus shift from learning and growth to constant threat detection. So if some children have gone through the trauma, the problem is, instead of learning and growing, like we as in the professional, we tend to reflect. If anything bad happens or an experience that we don't like, we tend to take a step back and reflect the things. People who have gone through the trauma, and if they have not dealt with it, they directly go to this, the end point. Why this has happened? Is it my fault? Okay, they go to the survival and they don't think of the alternative kind of options. So is this clear? Any question on this? No? Okay, so let's go to the next one. Now the three components of a trauma. Can go to the next slides. Okay. Now how you define the trauma? Okay, it's also good to define the trauma. There's acute trauma, which results from a single isolated event. Okay, single. Keep in mind single. Now chronic is where there's a repeated exposure and prolonged exposure, especially in domestic violence kind of thing, where you cannot escape and the cycle repeats again and again. Then there is a complex trauma. Okay, complex trauma is because of multiple kind of interpersonal, starting from the childhood. If the child grows in an environment where there's a constant fight, where our parents, make negative comments about them that you're good for nothing, you're not going to go. So this, it becomes an identity for that kid. Yeah, if there's a like beating or not having proper kind of food, that becomes an identity for the kid. Yeah, so they think that this is the real world, this is how the real world behaves. Then you have also got viscous like traumatic exposed from helping or healing about others' trauma, common in the responder and therapist. This is something that we need to be aware. As a clinician or as a therapist, if you also see a lot of people with trauma, sometimes those kind of imaginary kind of thing, you also take it and think that okay, actually it's happening to you. So it's very important for us to understand. Yeah. So are you guys clear on the 4 topics? Okay. So let's go to the next one. Now we also need to understand, what are the impact the trauma has. If you look at the kid's brain, yeah, so it's going to impact on the cognitive impairment. The kids are not able to focus on, studies or develop the proper skills to cope. Focusing on survival. Okay, so they are in a constant kind of survival. Is anyone going to harm me? Okay, then focus. So they are in constant kind of looking here and there for their safety. Then impairment, the way they think is quite distorted. They are not able to think in a clear kind of sense. Yeah. Now the physical. So it's not just the mental side. There's also a physical side. If you are grown in an environment, because of that, you're not able to take care of your physical health. So, chronic stress can also cause irregular heart, adverse, and a lot of somatic symptoms. If you work in the CAMS kind of, children unit, you will see a lot of somatic symptoms because there's a bit of stigma with the mental health. If you go to A&E and say, I'm stressed and this and that, go to psychologist and this and that. But if they come, okay, I'm panicking, I'm not able to breathe, this and that, they tend to do a lot of investigations and blood tests, and they feel like, okay, someone is listening to me. Then you also have to think that, this is how they, react with anger. They're not able to regulate their emotions. So this is like the starting point of personality disorder. Yeah, deep-seated shame and poor self-esteem. They don't have the confidence at all. Yeah. So these are all the starting point of PTSD, anxiety, and depression. Yeah. Now, keep in mind, people who have gone through this, they are not able to develop the proper kind of trust in relationship. Yeah. So they struggle maintaining, long-term relationship. It also, they are not able to trust and safety. Okay. And because of that, you will also find a bit of anxious and avoidance pattern in kind of building the relationship. And profound impact of childhood trauma. And this is something which is called generation trauma. If the adults are not able to manage their emotions, they are teaching the same thing to the kids, and the cycle goes on and on. Okay, so are you clear about this? Thanks. Okay, next slide. Okay, so the components is the framework. The stress happens, accident, abuse, and this. Now there are two ways of responding to it. Okay, one is you may become overwhelmed, terrorized. The other people who have received a proper kind of support and environment, they are resilient and supported. Okay, they are given the skills by the people who are more, experienced. So the environment is very important where the person grows. Yeah. So this also helps them to define what is terror and helplessness. So keep in mind, two persons can react differently to the same event. So it's not just the event that happened, it also depends on how you respond to the event. Does that make sense? Okay. And because of that, because of how you respond, it also impacts the impact of how the long-term impact is going to be. Yeah. So it's very important to understand and integrate the pattern, where to break the patterns. Yeah. So let's go to the next one. Now, how does it manifest? Yeah. Can you go to the next one? Okay. So if you look at how is going to manifest is constant stress and high alert. Okay. Constant state of fear, dysregulations. Okay. So this is what we see in a lot of personality problem. Then adverse effect, abuse, home, neglect, accumulation of early childhood. Okay. So keep in mind, the kid, even when they are physically grown up, they are still a kid because of the trauma that they have. And its long-term consequences, it's not just the mental health, okay, it's also going to impact on a lot of physical health. Keep in mind, people who have got this kind of thing, they're not able to maintain a healthy life. They are not able to eat well. They are not aware of proper way to look after themselves. Okay, so the indirectly or directly, it causes a lot of physical health problems. Yeah, next. So this we have already discussed. Yeah. So this is like the same. Okay. Yeah. Let's go to the next one. Yeah. So this is behavior kind of thing. I think this also. So keep in mind, this thing I want to highlight. Now, if you are not able to deal in the childhood trauma, when you grow up, this is how you deal with it. Okay. Stress loop. You have got a maladaptive way of dealing with it. So you might look for a sort of way to cope with it. Substance. Yeah. Eating disorder. Where do you find eating disorder? Male or female teenagers? Yeah. This happens of bullying in the school. You're not beautiful. You doesn't look like that. And if there are strict parents, high standard kind of maintenance. So the people always look for control, and the control is eating. So the eating disorder happens on that. Yeah. Self-harm, risky behavior, and this is long-term consequences which we have already discussed. Go to the next one. Okay, so you can also see that it also impacts how we deal with people. Fear, okay, shadow shifting. So keep in mind that I've also reflected back that I've grown in a very strict family. Where my dad was a British Army. So my dad used to say, not to express your emotions. Boy, don't cry. They don't talk. So when I've grown up, I've also realized that the things which I've learned. Sometimes, if I'm unconscious, these are some of the things that, as an adult, I tend to, behave. So being aware, then only you can make a change. Yeah. Cycle, difficulty in trust, fear of intimacy. So keep in mind that I've seen a lot of cases where, especially when you are not safe as a child, when you get married or if you are in a relationship, you find the fear of intimacy. That means then why is this person loving me too much? Has there got some kind of motive? The cycle repeats. So that also impacts their relationship. Yeah. Repetitive on. So keep in mind that the way we interact with the children also helps them shape the way they grow up in adulthood. So the most important thing is we need to rewire our safety. Yeah. Hoping for healing. Yeah. Next slide. So this is all the things that, keep in mind that, if the children doesn't receive proper kind of environment at home, they're not able to focus in their studies, yeah? Survival, safety. So keep in mind the child, if they're always on the constant go of, I need to be safe and this, do you think that they are going to perform well in the school? No, not at all, okay? So indirectly, a lot of misconception which I've seen in the younger generation is, parents coming and saying that, whether my child has got autism, Asperger's, ADHD. Before we jump to the conclusion, first of all, we need to see whether the home environment is good or not. Does that make sense? Now the people are, the generation are too much focused on getting diagnosis, and they feel having a diagnosis, give them a medication and everything will be solved. But it's a complex issue. So things needs to be ruled out first before we jump to the diagnosis part. Keep in mind that it also impacts our memory. Yeah. Like for example, when we think about a childhood, we look at the our photos and this and that. So the way we stored and think about a childhood can also be distorted if we don't have the proper environment at home. Yeah. So the world views also depends. If you don't have this proper kind of thing, the way we see the world will be black and white. Yeah. Next slide. Now, we also need to understand this is the third part. So far, any question? No? Okay. So let us look at the neuroscience. This is the part which I find it very interesting. Okay. Now, keep in mind that our brain, whatever we experience, our brain is like a one which make a decision at the end of the day. Yeah. So if we are not aware of the trauma in this, our brain is at a constant go, like a fire alarm, so if you're not able to deal with it, we are not able to think logically, reasoning, or impulse control is not there, and our amygdala is the one which is a fear, fight, okay? So that is always on a constant go. So it's very important to understand the trauma, okay? So keep in mind this is like a visual representative, like a fire and smoke detector are like a trauma, okay? So we have got a control system in our brain. So if you are not able to address this, people with trauma, if they are not able, the control tower is offline. The control tower is offline. You're always thinking of scanning, looking here and there. Yeah. Then all of the symptoms you see: hypervigilance, flashback, emotional, survival. Yeah, because the tower is switched off. Let's go to the next one. Okay, so basically our brain we can divide into three parts to understand the trauma. Amygdala this is the part which is for flight and fight kind of reaction. If it's triggered, is on an hypervigilant, and the function of this is protection. So we have all of this, hyperactive, scanning inference. Now if you go to the dysregulation part, this is the prefrontal cortex. Okay, this is the one. This is the part of the brain to think logically, impact, and this is the one that controls the amygdala to calm it down. When trauma goes off, this is offline, the tower. That's the reason why, then you give a power to the amygdala to act, because this doesn't work. And hippocampal is the part of the area. What does the hippocampus do? Memory. So if you are not able to register this experience properly, the image that we record, do you think it's a true picture or fragmented picture we store?
Yeah, it's the one that the amygdala produces.
Yeah, so fragmented, okay? So the way we remember the time and place is distorted. It's not a true picture. And if it is distorted, keep in mind that all the hormones are disbalanced. Yeah. So clear with neuroplasticity. Okay, let's go to the next one. So this is just representation in the picture. Yeah. Okay. Have you noticed this one? Appeasing the survivor. Keep in mind that if you have grown up in a family where you always need a validation from your parents that good job done, you need to do this. Have you observed that when you grow up, subconsciously you're also repeating the same kind of thing from your manager or from your boss, asking permission to please. Okay, so keep in mind that that all of the things that happen in the childhood can also repeat in your adult life. Yeah. Next. Now, what we can do in order to address the trauma? Yeah. Next one. Okay. So first of all, we need to understand the pathway, how to do it. Okay. So understanding is number 1 point. Number 2 is our brain has got neuroplasticity. That means even the brain goes till the age of like 25, it's not fixed. Does that make sense? The brain can still evolve and we can still rewire the brain. Yeah. For that, what we need to do is we need to rewrite and healing the active path. It needs to be practice or repetition. The pattern that we are doing wrong, we need to first of all acknowledge. Second, we need to rewrite and we need to say how best we can do it in a different way. Conscious effort, practice and repetition. So we need to make the tower stronger. Yeah. The second thing is foundation of trauma is rewiring the attachment, cognition with the health. Okay. So we need to practice in terms of relationship. Yeah. The other one is adaptive behaviors. Okay. Regulation, learning. You all need to learn, connect, self-compassion, and you need to develop more of kind of like coping strategies, new techniques in order to deal with the trauma. So you need to update yourself. With the phone also, there's an update every time. So why don't we update ourselves? Are we too outdated? What happens if you don't update it? Nowadays, do you see Motorola, Nokia, any of these phones? Why not? Because they are not updated. Imagine in 10 years time, we might not see iPhone, we might not see Samsung. It might be replaced with something else. Panasonic, we don't see Panasonic now. We see Sony, Samsung. Okay. Next slide. With the therapy, what does the therapy does is, if you're struggling to rewire yourself, you can seek professional help. Professional help, they have got different skills, in order to help you to process the memories and nervous system. Okay. Safe relationship. Make sure the relationship which doesn't help you, you should learn to say no to the relationship and help to build a more healthy relationship. Compassion. Learning to treat oneself with kindness. This is the thing which I have seen less. We talk more about giving knowledge and policy, but we don't follow. Do you agree with that or not? We are not kind to ourselves sometimes. Yeah. So first of all, there's no shame in saying that I love myself. It's not a kind of like being selfish. But sometimes you also need to respect yourself and say, I love myself. Yeah. Mindfulness. Okay, you can use yoga, meditation, this. So this helps you to spend more time with yourself. It helps you to reflect and helps you to change the way you see the world. Yeah. Next. Okay. So in conclusion, keep in mind with trauma, it impacts your brain. Yeah. And keep in mind when brain is a lot of stress, it releases a lot of hormones, which also impacts your thinking pattern. First of all, in order to break the cycle, you need to understand power and step, and you need to do something different. Yeah. And recovery is not possible. Is not only possible but likely. Keep in mind, it's a constant kind of thing. It doesn't happen in 1 day or 2 days. Okay. You need to make a habit, and you need to make a lifestyle for it. Yeah. Go to the next one. Okay. Any question and answer? Yeah. So let us summarize, from this teaching, what have you learned and what are you going to do different with trauma?
Probably find out patient's history.
Yeah. One is patient, the professional is 9 to 5. Okay. How about your life? Are you going to make any changes in your life?
I reflection.
Self-reflection. Yeah, how about you?
Yeah, I